Well, October is Breast Cancer Awareness Month, but that's really only one aspect to overall women's health. We are here with Jada Verling Hill, DNP at Coastal Family Health Center. Tell us a little bit about women's health.
So women's health is inclusive of many different things. Of course, the mammogram, that's very special for a lot of people in October. They like to wait till Breast Cancer Month in October. But we also need to make sure we're getting our pap smears done. And so those guidelines have changed over the past few years, where instead of needing to do them annually, now they can be done every 3 or 5 years, depending on what type of test your provider had ordered at the time.
And so those are things that you perform here at the clinic?
Correct. We can do screening mammograms. Usually prior to your mammogram, we'll go ahead and do a clinical breast exam to ensure there's nothing abnormal going on, which would warrant a different type of mammogram done outside of our facility. But the screening mammograms, we start at age 40, and those are annually as long as everything is normal. The pap smears are also done right here in our clinic and many of our other Coastal Health Family Clinic centers as well.
So you mentioned that the specific mammogram you mentioned starts at 40. What if you have somebody in your family that had breast cancer at an earlier age? Would you recommend that it start earlier than 40?
Right, so the criteria for that would be to start 10 years sooner than the onset of diagnosis for that family member. So if your mother was 32, we would start imaging prior at 22. Sometimes you would need the mammogram earlier. There's some instances where you would actually need just a breast ultrasound due to the density of the breast. But definitely including a significant history of early onset breast cancer could warrant that you needed to start screening mammograms earlier.
And now this is something specifically with breast cancer that is easily, cured if it's found early.
That's correct. So that's why the recommendation is yearly. If you have a good baseline starting at age 40, it's very easy for the radiologist to see if there's any significant changes that have occurred from the prior 12 months. And this would, of course, clue us in that you may need a biopsy or some further diagnostic testing to diagnose a breast cancer, but in hopes that it would be caught early because you're doing your annual screenings.
Sure. So tell us, the Coastal Family Health Center has a special coming up.
That's correct. On October 19th from 9 to 1, we're going to be offering screening mammograms and or pap smears, so you can get both if you meet the requirements for only $25. And so this is our third year doing the event. It's been very successful the past 2 years. Anyone can come. You do not have to be a patient of Coastal at the time. It's a walk-up appointment. You do not have to have any insurance, and it's $25, like I said, if you want to do either or both of the exams if you qualify.
And there's not anything that you need to do prior to this exam. You don't have to set. It's not like you have to stop eating at a certain time. Like, there's no preventative thing
Correct.
you need to do.
And actually, we will have lots of door prizes, and we will have food and vendors as well. So while you're waiting to get your services done, there will be activities to entertain you and different things to help keep your interest while you're waiting to get your exams done.
Door prizes? What kind of door prizes are we talking about?
Oh, we have restaurant certificates and gift cards, and sometimes we have Blue Cliff come to do massages. Last year we had a belly dancer teacher here. So lots of different things, a variety of fun stuff to do while you're waiting.
So we were talking earlier, you mentioned that $25 is a very low entry barrier. This is a price that's lower than your normal low price for this procedure.
That's correct. That's cheaper than our usual low price for a GYN appointment here. It's also cheaper than some copays for insurances. So, if you haven't had your mammogram this year or in the past few years, or you're due for that PAP, go ahead and come on in. We can get both of those taken care of for you.
Now, is this in addition to maybe a normal doctor that you go to, or is this something that you're looking to treat folks that don't have a normal general practitioner?
Even if you see someone else for primary care outside of our clinic, you can come here for these services as long as you haven't had them within the recent time frame. And if you're looking to transition your primary care to here, we can also get you a follow-up scheduled after your GYN services. We have lots of other service lines at Coastal, and we would love to have you come adventure and see what could be good and accommodating for you.
And we mentioned this is the special that's specific to October 19th, right, in Breast Cancer Awareness Month. But women's health overall is something that you need to be focused on year round. This isn't something that we just look at in October and say, well, it's time to focus now because this is when everyone else is focusing. This is something, especially if there are other members of the family that have conditions, this is something you need to be focused on year round.
That's correct. And if you've had abnormal pap or mammograms in the past, or you're noticing any abnormal symptoms, definitely advisable to follow up before that 12-month mark. You do not have to wait till October. If you notice something abnormal, you should definitely consult the provider sooner, and we'd be glad to have you here.
What are some of the other women's health, tests or conversations that you're having here at Coastal
So
Family
we do offer full STD screening. We offer pre-pregnancy counseling. We offer obstetric services, labs, and different types of radiology. So there's a lot of different things. A lot of times we'll recommend you need to follow up with primary care prior to conception to get some comorbid things, maybe diabetes or hypertension, more controlled to make a healthier pregnancy. So it's very easy if you have lots of care here with primary, and then it's a quicker transition, if you were to be able to come pregnant, to go ahead and continue your pregnancy care here.
So are there any qualifiers for individuals who may be interested in seeking services here?
You just need your ID, normal registration things. If you have insurance, of course, bring that. But we accept new patients daily, so it's pretty easy to get an appointment. Just get signed up.
And it's typically, for those individuals who don't have insurance, it's typically very affordable here.
Right. We do offer a slide based on your household financial income. So there's a lot of different options. We also have different grants and programs to help cover cost or help decrease costs for patients that may not have insurance or have the income to support coming to their visits.
And so that is on top of any other additional care you're receiving outside of here.
That's correct. And so, a goal would be, if you're kind of double dipping in different clinics, we could get everything streamlined here. We do also have clinical pharmacists that come and they help to streamline medications and help make things simpler and maybe more affordable for patients. And they can use our pharmacy. It's always a cheaper price usually than retail. So there's a lot of different options for the patients once they get established here.
And you're not just located on Division Street in Biloxi, you have other locations?
Oh, correct. So we also have women's health at our Gulfport location on Martin Luther King Drive, but Coastal is across the Mississippi Gulf Coast, and we have offices up into State Line, Loosedale. So we cover each end of the coast, and we're moving further north every day.
And then when you can't come into, the clinic, you have a mobile clinic that you send out into the community from time to time as well.
That's correct. Our mobile unit does different events. They go to different places. They offer different services. So there's a specific schedule for there, or if you need immunizations, there's a vaccine schedule, and they target different populations on different days. So there's a lot that the mobile unit incorporates in the community as well.
So you want to be on the lookout for all of that. And I guess the key right now is staying ahead of everything, coming in early. Women are not like men. We don't like to go to the hospital for anything, to the doctor for anything, but staying ahead of it is definitely the key to staying healthy.
That's right. And once you go ahead and get established here, we can tell you your recommendations, when you're supposed to follow back up, how frequently you need to come, and based on your results, that you may be a higher risk, or we may need to have you be followed by a specialist somewhere else.
Perfect. Thanks, Jada.
You're welcome.